Okay, Lola here now. Okay. So once again, welcome to all of you, Dr. Yathin, and President and members of the Alumni Association, Ramya and team, and our friends from the WISE group from Colombo Plan training, and the office bearers of the ISUP India, some of them I have seen inside, and all my friends. So we have come to one more webinar today. I appreciate the Alumni Association for choosing a beautiful, relevant theme. All of us are actually SUD workers. We are SUD professionals, but we cannot ignore that there is some other behavioral addictions also growing in the same sort of intensity. So that's why we have chosen this, the impact of behavioral addictions on mental health. And we have Dr. Yathin, an expert in the field, to speak to you today. Now, of course, we are just coming to normalcy after our COVID and lockdowns and things like that. And one impact of the 2 years of lockdown was that we have been reduced to, or our world has been reduced to a small screen that we were all depending upon that for anything and everything. And on the process, some of us may have developed some sort of a dependency or addiction to even small screens. And at the same time, with whatever the opportunities or the things related to that smartphone and internet and things like that. Some of us could be addicted to the games and things like that. So anyway, all those things Dr. Yathin will be describing to you. So I don't want to waste my time on that. So now I leave the forum to our EchoLink Alumni Association and team. Over to Ramya and Shalini to introduce the topic and then introduce the speaker and open the program. Over to Ramya, if you are there, a few words, and then Shalini will introduce the...
Yes. Hi, everyone, and welcome to the forum. Very happy to be here at this program again after a very long time. The alumni has planned a webinar along with EchoLink Institute under Sir's guidance. The alumni is a growing and a very robust community from across the globe, and very excited that I got to be I got to champion leading it in some ways for at least in the initial parts of the alumni's creation, and very excited that it is being taken forward. And I'd like you all to make the most out of these webinars and join these webinars. And soon we will have a motto for the alumni of contributing, being part of this community, and also giving back to the society. And I would request Shalini to take over and take this forward. Thank you.
Thank you so much. Namaste. Good evening, everyone. Such a lovely evening with our eminent dignitaries, guests, and participants from all across the globe. I welcome you all on behalf of EchoLink Alumni Association to today's webinar, Impact of Behavioral Addiction on Mental Health. Behavioral addiction is seen all around us, such as in scrolling WhatsApp, gambling, video games, binge eating, and many to the list. This webinar is hosted by EchoLink Alumni Association, headed by our president, Ms. Ramya. EchoLink Alumni Association is a group of trained UTC professionals from 17 countries by EchoLink Institute of Wellbeing. EchoLink Institute is an approved training provider of Colombo Plan Drug Advisory Program, which is currently involved in training addiction professionals. Without wasting any time, I would like to take the opportunity to introduce our distinct resource person for the evening, Dr. Yathin Pal Singh. Dr. Yathin is a renowned psychiatrist from All India Institute of Medical Sciences, New Delhi. He also serves as an additional professor of psychiatry at AIIMS, Delhi, as well as AIIMS, Rishikesh. Dr. Singh is a global trainer for Colombo Plan Drug Advisory Program, World Health Organization, and UNODC. He occasionally serves as an honorary trainer for Ecolink Institute as well. Along with this, he is a visiting professor at King's College, London, UK, University of Adelaide, Australia, Virginia Commonwealth University, USA. He has more than 200 publications to his credit. Dr. Yathin is a winner of several awards for his excellence in the field of psychiatry. It is an esteemed opportunity, pleasure, and honor to hear from him. I'm sure that all of us present here will benefit from his rich knowledge and experience in the field. Before inviting Yathin sir, I would humbly request you all to keep yourself muted for an uninterrupted session. Also, we'll be sharing a form at the end of the session, which will help you in procuring a certificate. So please do fill the same once shared in the chat box at the end of the session. Now, with immense pride, I welcome Yathin sir to share his valuable knowledge on the planned topic. Over to you, sir.
Thank you, Shalini, for those kind words. Thank you, Mr. Thomas, for this opportunity to be here. I mean, I'm pleased to know that there is a Alumni Association of Ecolink Trainees. And I mean, you have participants from 17 countries. I didn't know that. So it's good to know that. And I thank you all for being here, taking time out from your day and willing to listen to me, to my thoughts on this topic. So I'll be sharing my screen now. I think I need to make a correction what Shalini ji said about while introducing me. I do work at AIIMS. I have an association with King's College as well, but I don't work as a faculty over there. I used to be a regional mentor for them on their addiction program. But I think I'll take if I could become a faculty over there someday.
Apologies,
Thank
sir.
you-
Sorry
thank
for
you
that.
the wishes. But jokes apart, let's come to the topic. I'll be speaking for the next, say, 45 minutes or so, and I'll be talking about behavioral addictions, and I will be talking about the concept, what it means, what are the different types of behavioral addictions, what are the key themes that we need to be aware of. I'll talk about what are the implications of behavioral addictions in terms of the consequences. And finally, I'll also touch upon how we approach those individuals who are living with these addictions. Now, please do remember, and I must mention this before I begin, that this is just a 45-minute presentation, and I won't be, or I even don't intend to cover everything about behavioral addictions in this presentation. So please treat it as a primer or maybe a basic introductory session on behavioral addictions. Of course, if you have any questions, please do ask at the end of the session, and I'll try to answer them to the best of my abilities. But there might be certain issues and themes that I may not be able to speak about. So in case something else comes to your mind while you go through my slides and my talk, please make a note of it, and I'll be happy to make an attempt to answer those questions. Now, let's start with the concept of behavioral addictions. Now, addictions, as we all know, I mean, you all have been working in this area for many years, and you yourself have been trained, credentialed, provide clinical care. Some of you might be trainers as well. And addictions is not a new concept. We have known it for many years now. But traditionally, whenever we have talked about addiction, our association has been like addiction happens to, say, drugs. Drugs would mean things like cannabis, heroin, cocaine, or alcohol, or tobacco products like cigarettes and things like that. And that is what our understanding has been, that there has to be a chemical which is called a psychoactive substance, which reaches our brain and it alters its functioning. And we all know there are different mechanisms how it works. There are receptors, there are neurotransmitters where these chemicals go, attach, and they produce their effects. But over the years, we have realized that we need not always have to have chemicals in our body for addictions to develop. And in fact, certain behaviors that we engage in can be as addictive as some of these chemicals that we have known for these years. And it is these behaviors which eventually end up being addictions that are known as behavioral addictions, or some people prefer to use the phrase addictive behaviors, but both of these mean the same. Now, there are different ways to define behavioral addictions, and there is no single best definition that I can kind of suggest to that this is the best one, but there is a very simple one, a very simple definition, which, while being simple, is quite self-explanatory as well. So one of the ways to define behavioral addictions is that these are syndromes, and we know what syndrome is. Syndrome is simply a cluster of signs and symptoms which are similar or analogous to psychoactive substance addiction. But here the focus is a behavior rather than consumption of a substance. So this definition tells us that we are talking about something which is very similar to psychoactive substance related addictions. However, rather than a chemical, the focus is a behavior which becomes excessive, out of control, which makes us neglect our responsibilities and other interests in life. And we tend to engage them despite of adverse consequences. So that's how we can define or describe behavioral addictions. Behavioral addictions are also known as non-substance addictions, which means non-psychoactive substance addictions, because these are not chemical related addictions. People call these process addictions as well, because there is that behavior or a process to which human beings tend to get addicted to. So these are some of the synonyms that have been used for behavioral addictions. Now, interestingly, people believe that it's a new concept, and it is in some ways, because we didn't used to talk about these disorders maybe as often as we do it today, just 10 years back, which makes us kind of think that, is it something very new? But you might be surprised to know that it's not a very new concept per se. People have been talking about something similar, although they did not use the phrase behavioral addictions. But addiction to non-substances has been reported and documented in literature, and it dates back to 1950s, when researchers, they started talking about addiction to watching TV. And that was around the time when TV actually became publicly available transmission, and there were programs available. People have talked about addiction to exercises, acquisition of wealth, solving Rubik's Cube, sex-related addictions, and even overeating as an addiction has been reported. And this concept has been there in literature for many years. But in the more modern way, it probably came to forefront when the term internet addiction came into being in mid-1990s. And that again happened very soon after the advent of internet. And in the more recent times, our focus on addiction in terms of behavioral addictions is primarily related with internet and activities we engage using internet. For example, use of social media, OTT platforms, which we use to watch videos that are streamed through these platforms, or online gaming related activities. So that's the main, that's how this increased focus has been on these addictions. But another behavioral addiction, which is even probably more prevalent and has been there for many years, is related to gambling. And that also has been around as a diagnosis for more years than we kind of probably assume it to be. So what I'm trying to emphasize here is that it's not something entirely very new, but yes, we have started to talk more about these disorders in recent years. Now, the term behavioral addiction kind of tells us or makes us assume that is it possible that each and every behavior that we engage in can potentially turn into an addiction? Now, this again is a very important concept that we need to understand, because like psychoactive substances. So by definition, psychoactive substance is something which can lead to features suggestive of addiction, at least in some individuals. But we cannot draw the same parallel when it comes to behavioral addictions. So what it means is that it's not that each and every behavior that humans engage in can eventually turn out to be an addiction. So there is nothing like for every behavior, there is a green zone. And then when you overdo it, it enters the red zone, which is the problematic zone or the zone where addiction lies. For a particular behavior to become addictive, it has to have certain attributes. And it's very similar to the psychoactive substances. Not every chemical is psychoactive. They have to have certain properties, and in only those chemicals who share those properties, there can be eventual addiction. And the same is true for behavioral addictions as well. So these are some of the features that the behavior should have in order for these behaviors to turn into addictions. One of these is salience, which simply means that the behavior should have the capability to become the most important or the most dominating activity for a person. And what that means is that it should have this attribute where a person could engage in this particular behavior as the most important activity in their lives. So that's one of the attributes. Second attribute is that the behavior should be able to modify the mood of the person. And this again can happen in two ways. One of the ways is that our mood is normal, or what we call as euthymic, and the behavior kind of elevates it towards the positive side. That's one way. The second way could be that our mood is less than normal. Less than normal means it's on the negative side of the spectrum. That is, we are either feeling anxious or depressed or stressed. And once we engage in the behavior, it improves our mood. It kind of lifts our mood. So that is the second attribute that such behaviors should have. People suggest that it should also lead to tolerance. And we know what that means, that once we start engaging in that behavior, we tend to get used to it. And so we need to engage in more of it over time, so as to feel the same kind of effects or pleasures as we were feeling earlier. There can be withdrawals, not necessarily physical withdrawals, but at least psychological. For example, feeling uneasy, feeling uncomfortable, feeling irritable, experiencing disturbance with the sleep, not feeling very good. So things like that can happen once you are not allowed to engage in that behavior. It should also lead to conflict, and that means that the way you are engaging in that behavior and the way others, perceive your situation, and there is a discrepancy there. So while you are okay or you are comfortable excessively engaging in the behavior, people around you might think that what you are doing is excessive and you should not do that, and that can lead to interpersonal difficulties. And finally, like any other addiction, it should have a tendency to relapse. That is, even when you try to stop it or you are successful in cutting down on it, it tends to come back and you tend to engage in the behavior excessively in a problematic pattern once again. So these are some of the attributes that kind of help or make a behavior conducive to become addictive. So there are so many things that we do which don't fall into this category of potentially addictive behaviors. So please use this concept very selectively, only in the sense where it can be feasible for a behavioral to be addictive. We cannot just use it as a loose term to describe anything that we are doing excessively and claiming that it is a behavioral addiction. It doesn't work that way. It is a very precise use that we need to follow while we are using this concept. Now, there are many kind of behavioral addictions that have been described in literature, and even in the recent literature. It's not that I'm talking from 20 or 30 years back. I'm talking about even in current context, there are many human behaviors that have been linked to addictions. This includes exercise, eating, shopping or buying, sexual, mobile, internet, selfie, social media use, gaming, and things like that. But please remember another important learning, and this learning comes from the research that we have, that while these behaviors have been described as potentially addictive, the level of research that exists and the level of research that supports that whether these are truly addictions or not, it varies from one disorder to other. So two disorders which have the strongest research evidence, that is, these disorders have been more or most widely acknowledged as addictive behaviors, are the gambling disorder and the gaming disorder, which is online gaming as well as offline gaming. Other disorders like internet addiction, sexual addictions, shopping addiction, exercise addiction, they do have evidence to support them, but it's not same or similar both in terms of quantity as well as quality. So what that means is that not all behavioral addictions have been recognized by the diagnostic systems. Now, I hope you all are familiar with terms DSM and ICD, which are the diagnostic manuals that we follow while we are diagnosing people with psychiatric disorders. Now, in these diagnostic manuals, all these disorders are not listed. For example, in ICD-11, only gambling disorder and gaming disorder exists. The other behavioral addictions are not yet there. And the reason given is that the evidence is not so strong or is not so convincing yet to include them in the diagnostic systems. But that doesn't mean that they don't cause problem or they will not come into the diagnostic systems later. They are likely to come because as the evidence grows, these will be acknowledged as addictions as well in time to come, but not as of now as per ICD or DSM-5. Now, another important thing that we need to keep in mind, which is very different from our understanding of substance use disorders. Typically, when you talk of substance use disorder, we can very safely and very easily say that when a person starts using substance, and when you compare that to a person who is not using substance, those who are not using substance are not considered abnormal. So not using a psychoactive substance is okay, is fine. So those people are considered as people who don't have any abnormality. But the same or a parallel corollary can't be drawn for behavioral addictions. So for example, if you look at this list of some of the addictions, you see these terms such as exercise, eating, shopping, sexual activity, mobile phone use, taking selfies. They are not pathological in themselves. What it means is that while alcohol use can lead to alcohol use disorder or alcohol abuse or harmful use or hazardous use, shopping is a normal activity for majority of us. Eating is a normal activity for majority of us. Exercising is a recommended activity for all of us. Similarly, mobile phone use is not pathological in itself. So this again is a very, very important departure from the concept of substance use disorders, where we can or we tend to give a message that avoid using drugs, say no to drugs. But the same kind of message doesn't work for behavioral addictions, because we cannot say don't exercise, don't eat, don't shop, don't use mobile phones, because these are normal healthy behaviors for a large majority of us. It's only when they become excessive or they are engaged in a problematic manner, then they become problems. So we cannot simply label somebody with addiction because they are carrying a mobile phone in their pocket. That's very important for us to understand. Similarly, our approach cannot be then destroy the mobile phone, it will take care of your addiction. And I'll come to that later. So that again is something that we need to be familiar about as a concept. Now, another common confusion and misconception people have is that, okay, because substance use disorders include psychoactive substances, they are chemicals, they are supposed to reach the brain and then they will affect the brain. So there is a biological basis to those addictions. But since we are talking about behavioral addictions, it's nothing to do with the biology. It's only the behavior that is at the core or at the center. That's not true. There is a reasonable amount of evidence that now supports that different brain systems are involved in behavioral addictions as well. And most of this evidence comes from gambling disorder and some from the gaming disorder as well, where the role of reward circuit has been reported, very similar to something related to substance use disorders. So reward circuit is something that is involved in emergence of behavioral addictions as well. Similarly, other parts of the brain, for example, the prefrontal cortex, which is responsible for us to make decisions, when should we act, when we should not act, when should we stop engaging in a behavior. So those kind of deficits have also been reported in cases with behavioral addictions. So this again means that there is a problem in the functioning of the brain, which is responsible for behavioral addictions, similar to substance use disorders. And that's not the only part of the brain. There are so many other systems. For example, there are the parts of the brain which are responsible for controlling our impulse. There are parts of our brain which form memories of these behaviors, which remind us that, okay, you liked this thing. There is a hand that has been raised. Ramya ji, you want to say something?
Sorry to interrupt. So can you take us back to the previous slide? Just wanted to make a note of the question, which I will ask at the end.
Okay.
Thank you. When you sort of breeze through this is the part we've all learned, and this is forms the core of our training as well. So it's very interesting to see the association with the different parts of the brain. So it's very relevant for all of us. Thank you.
So similarly, as I mentioned, there are other systems in our brain. For example, those who are responsible for impulses, the systems that are responsible for memory formation, which kind of help us recollect the kind of good experience we had engaging in these behaviors. So there are different brain networks that are implicated in behavioral addictions as well. And similar to the substance use disorder, there are different kind of neurotransmitters that are involved: serotonin, opioid receptors, norepinephrine, glutamate. So the point I'm trying to emphasize is that we should not assume that since these are behavioral addictions, they have nothing to do with the biology or the brain. They have the biological components as one of the important elements. And we need to conceptualize them using the same paradigm as we use for SUD. So there are biological components which are responsible for these. Some of these I've talked about recently. In fact, there are some genetic factors that have been studied as well, like SUD, which increase the risk of having behavioral addictions. There are psychological factors which can predispose a person to the risk of developing behavioral addictions. And again, there are environmental factors. For example, age of exposure, how long you are exposed to a particular behavior, what are the alternatives that you have in your life, so that you could have taken those behaviors vis-a-vis this behavior which becomes problematic. So it's not a very simplistic situation that you are carrying a mobile phone in your pocket, and since it is there with you all the time, you will eventually end up having an addiction. Most of us carry mobile phones with us 24 hours a day, but that's not good enough in itself to cause addiction. There are predispositions in a person biologically, psychologically, and then there are so many environmental factors which interact to eventually produce these addictions. So it's not just the exposure. For example, in substance use disorders, we know that not everybody who starts using a substance eventually develops dependence. In fact, majority of people who start using, say, alcohol or cigarettes, they do not develop addiction. Only a small proportion does. So the same is true for addictive behaviors as well. Now, why is it important? How does it matter if you use your mobile phone excessively, or if you're playing games excessively, or if you are gambling excessively, or if you're shopping excessively? How does it matter? It matters in many ways. There are multiple implications. And again, I'm using a similar a paradigm very similar to SUD so that it's familiar to us and we can connect the two and find the connections easily. It impacts our health, which includes the physical health as well as the mental health. It impacts academically. I'm talking academically because some of these addictions are more prevalent among adolescents and young adults who are still completing their education. It can impact us occupationally, interpersonally, and even financial implications are there. In terms of health, it can impact our physical health in many ways. It can impact our physical health through three main mechanisms. One is that we engage in a particular behavior excessively, and that is something that leads to overuse of body parts, which can lead to problems. The second mechanism is that since we are using or engaging in one particular behavior excessively, we are neglecting or limiting other activities, which can also lead to certain physical problems. And finally, there can be improper usage, for example, improper posture while using these devices or engaging in these behaviors, which can also lead to problem. And there can be problems in different parts and different systems of the body. And you must have heard of something called as carpal tunnel syndrome, which is something in which we develop pain in our wrist joints. And this is because of excessive use of our wrists while we are using keyboards or mouse. People who use mobile phones excessively, there can be problem in their thumbs and they can develop pain, swelling in their thumb joints. So there can be problems with our joints. In addition, there can be problem in our back and our neck. We can have pain because of the wrong posture and sitting for long times or lying down while using these devices. So because of poor ergonomics, because of poor posturing while we are engaging in these behaviors, there can be problems in those parts of the body. People who look at screens for long times, it can lead to headaches, particularly if the screen is of not good resolution, if there is flickering, if the screen is pixelated, if the resolution is not good, it can lead to strain and it can cause headaches. Now, there can be problems in the eyes as well. There is something called as computer vision syndrome, again because of excessive staring on a screen without taking breaks, without blinking our eyes in between. We can have dryness in eyes, itchiness, redness, blurring of vision, headaches, backaches, neck ache, muscle fatigue. So all these symptoms can happen because of excessive use of screens or excessive looking at the screen. There can be problems with our ear health when we are using those microphones or headphones, earphones and headphones, and we are listening to noises at loud level, particularly higher than 80 decibels. It can cause hearing impairment, which can be temporary or permanent, depending on what the noise level is or for how long we have been listening to that high level or high volume voice. Even more common problems which people face when they engage in these behaviors excessively is the disturbance of sleep-wake cycle. And again, it can happen in many ways. For example, we could start sleeping later, or we may be waking up later, which is a disturbance from the previous cycle. The sleep may be disturbed. We may be waking up multiple times during the night, or it may be non-refreshing, that in spite of sleeping, we don't feel fresh in the morning. So there can be problems with the sleep-wake cycle. It impacts our eating habits as well, because many times when we are busy engaging in the behavior, we may neglect our eating habits. We may neglect healthy food. we may prefer using something that is readily available and ready to eat. And we might eat foods that are rich in calories, which can lead to problems of excessive weight gain. And we know how excessive weight gain can cause so many non-communicable diseases like diabetes, cardiac problems. And for some cancers also, the risk increases because of excessive weight gain. Besides physical health, there can be problems in our mental health as well. Two of the most common psychiatric disorders which are seen in people with behavioral addictions is depression and anxiety. And depression and anxiety has a two-way relation with behavioral addictions. There are people who have depressive and anxiety symptoms who start engaging in behavioral addictions to feel better about themselves. On the other hand, there are people who develop addictions first and then they tend to develop depression and anxiety. So it can happen either ways, but a large proportion of people who end up having behavioral addictions, they do experience depression and anxiety because some of the adverse consequences, like when I'll talk about occupation, academic, finances, which get disturbed because of behavioral addictions, they can eventually make a person experience the anxiety disorder and depressive disorder. In addition, especially relevant to children and adolescents, when they engage in these behaviors and they are watching content which includes violence or aggression, this excessive exposure to violence and aggression can lead to increased thresholds while they react to violence or respond to violence. The violence may become normative for these individuals. They may tend to assume that it's acceptable to engage in violent behavior to a large extent. So that's something that leads to violent behavior within these individuals as well, because they are more accepting of this behavior themselves. So that's another mental health or personality related change that can happen because of excessive exposure to violence and aggression. Now, as I had mentioned earlier, these days WHO recognizes gaming disorder and gambling disorder as diagnosable mental health conditions. So like you have heard of substance use disorders, schizophrenia, depressive disorder, anxiety disorder, the same way gaming disorder and gambling disorder are now diagnosable psychiatric disorders, which can be assigned to a person who meets those diagnostic criteria. There can be many academic and occupational problems. Since you prefer to engage in the behavior that you are interested in, you can lose interest in your studies or your job. You may end up having poor concentration, not able to function or deliver the way you could have done earlier. You tend to become absent from your job or from the classes. Your performance starts going down. And if you are a student, you may even fail in exams. And in our clinic, we do get cases where people have failed in their schools and even colleges because they could not study, they could not focus on their studies because of excessive engagement in these behaviors. There can be interpersonal problems because now you are taking time away from your relations and you are putting your time more in these behaviors. It impacts your relations with people around you. You may get annoyed when people point to you that you are not spending time with them. You may get annoyed when people try to stop you from doing a particular behavior, and that can lead to interpersonal difficulties. There can be financial problems. For example, with gambling, excessive shopping, you can easily find the connection because you are spending a lot, and that's why you can start losing money. But even behaviors like excessive gaming, there can be financial problems because many of these games, they include elements of purchasing things while you are playing those games, purchasing skins, avatars, and things like that. And you may end up losing lots of money while you are engaging in these behaviors. Also, most of these consequences, they are interconnected. If you experience one of these, it can eventually lead to the other. As I talked about earlier, if you lose a lot of money because of excessive gambling, it may lead to onset of depressive episode in a person. So it's not that you will experience only one or two of these. If these problems, they start to appear, usually one of these leads to the other. and eventually people end up having all kind of adverse consequences. Again, something very similar to SUD. While SUD is a problem of health primarily, it impacts the interpersonal relations, families, finances, occupation, academics. So all these are connected. So that's why it's very important to kind of focus on these disorders when we deal with our clients. Now, one of the simplest concept that we need to help our clients understand is that people tend to kind of question that what is the right amount of time to engage in a particular behavior. For example, how much time should I spend online, or how much time should I spend with mobile phones? So please help them understand this simple concept. We all have this fixed 24 hours during our days, and that's true for all of us. So the more you spend engaging in these behaviors, the less time you have for rest of the activities in your day. And these activities are so many. It includes sleeping, it includes eating, it includes personal care, it includes talking to people, it includes engaging in physical activity, it includes going to work, it includes going to school. So even if you are not spending too much time, even if you're spending a little time, you're taking that time away from something else. So that again is a very important concept that we need to understand. It's not like substance use. For example, there may be a person who uses one drink in a week, and it might fall into that permissible limit of use given by some agencies. But with behavioral addictions, the more the time we spend engaging in those behaviors, we are taking time away from something that may be equally or even more important for us. So that's very important for us to consider. Now, detecting problematic pattern of use is not difficult. Of course, there are more standardized way of making these assessments, but at our own level, we can help our clients to kind of self-assess themselves, and we can ask them very simple things. For example, how much time are you spending, and how much time are you taking away from the other activities? And you can ask them to make a comparison, say maybe 6 months back, when you were not so extensively engaged in that behavior. So help them list that difference, what it was used to be six months back, your a typical day, and how it looks like today. So you will find so many other things that they are neglecting now. That can be one of the ways. But even more important than the amount of time is, what are your motives behind that behavior? So, for example, let's take the example of internet use. Now, internet can be used for multiple activities: attending a webinar, taking a class, taking an online course. But it can also be used to watch movies, watch videos, being there on social media, playing online games. So not all these behaviors are addictive. Attending webinars probably is not going to be an addiction for any of us. Taking up online courses is unlikely to become an addiction, but playing games can become, watching movies can become. So the motive is very important. Similarly, what is it that we expect when we engage in these behaviors? And I'll cite a simple example of using social media. Now, we can use social media for with multiple expectations. One of the expectation could be that I want to connect with somebody who is important to me, and that's okay. There is nothing wrong with that. But when I use social media to post something there, and my expectation is that the validity of my post depends on how much likes I am getting, or how many forwards I am getting, how many shares I am getting, then there is a problem with our expectation. And we need to see what we are expecting when we are engaging in a particular behavior. And that again can give us a clue that we are doing it for the right reason or for the wrong reasons. Similarly, if you are using these behaviors as a substitution, and substitution means that there is another activity that you can engage in, but rather than doing that, you are preferring to do this. So that again is an indicator. So rather than meeting people in person or face to face, you prefer to kind of chat with them or post on their social media profiles. So there is that substitution that's happening. Rather than playing with your friends in, say, playgrounds, you are preferring to play with them online. So there is a substitution that's taking place. So that's another indicator that probably you are moving in the wrong direction with your behavior. Change in your interaction pattern with people around you. It may be your parents, your siblings, your friends, your spouse. If you look back on your relation, the kind of time, the quality of time that you are spending with them, if there is a change, that again is an indicator that probably you are doing something which is not healthy or helpful. If you get angry or annoyed or irritable when people try to ask you to restrict your behavior, that again is a very good indicator that probably the way you are looking at this behavior and the way others around you are looking at it, there is a discrepancy. So you may need to relook and revisit whether you need to cut down on your behavior or not. So there can be many so-called indicators or red flag signs that can help us identify at our own level that whether what we are doing is more than what we should be doing or not. But again, these are not diagnostic. These are just helpful tips for us to look within ourselves whether we need to do something about our behavior or not. Now, in terms of managing behavioral addictions, it follows a very systematic approach as we do for SUD. There are tools that are available for screening. There are many of them. Depending on which behavior you are targeting, there are tools which are specific to each behavior. They are validated, they are reliable as well. There are assessment protocols that exist. There are diagnostic criteria. For example, to diagnose gambling disorder, you need to have specific set of clinical features for a specific duration of time. Only then you can diagnose a person with gambling disorder or gaming disorder. Even for conditions which are not there in, say, ICD as of now, researchers have proposed their different criteria, so they can be used. But it's not simply that I think I shop a lot, so that's why I think I am having shopping addiction. So you have to follow those set of clinical features, and only if they are present, then only we diagnose a person with these behavioral addictions. And finally, there are management protocols that exist as well, and I'll come to that in a while. As I mentioned earlier, ICD recognizes only 2 of them as of now. But if you look at research studies, there are criteria available for other addictive behaviors as well. Now, in terms of management, there are 2 key things that we need to keep into consideration. One is when we are managing these patients, we have to first manage the addiction, which is the behavioral addiction. But there is a very high chance that these people are having comorbid conditions. And comorbidity can be psychiatric problems, or it can be substance use disorder problems as well. So whenever we are managing a patient with behavioral addiction, we always assess them for presence of comorbidity. And more often than not, they do have a comorbid condition, and we need to treat that as well. Now, in terms of management, there are different interventions that exist. I would say that this evidence base is not as strong as substance use disorders, but many of the interventions which you probably have learned for SUD management, they exist for behavioral addictions as well, including self-help groups like Gamblers Anonymous, MET, CBT, behavior therapy, family therapy. There are online helplines that exist, which can be accessed by people who have problematic pattern of these behaviors. Of all these therapies, although CBT is the one which has the strongest evidence base, and as you would remember from your understanding of substance use disorders, it's quite similar to that, although there are some differences. It also talks about distal and proximal risk factors. It also talks about the concept of operant conditioning, that is reinforcement. But there is a slight difference when it comes to CBT here. In CBT for SUD, we may target the behavior as pathological. Our approach may be that let's help you stop using the substance. Here, the focus is slightly different. Here, our focus is that let's help you stop the problematic engagement in the behavior, while you may still be able to engage in the behavior for the right reasons. For example, a person who is playing excessive online games, we need to target excessive gaming but we need not stop this person from using internet to kind of attend online classes. So that's the difference that we need to keep in mind in terms of CBT for these disorders. The CBT primarily starts with behavior modification. That is how you can regulate your behavior. In the second phase, we target the cognition, the core beliefs, the schemas, the automatic thoughts. And finally, we try to explore that what is at the core of this problematic behavior, because many a times this behavior is the final or external manifestation of something that lies deep within the person, which can be a comorbid condition or a stressor, or maybe a compensation for something that a person feels he or she doesn't have or is lacking in their life. So that is what we target in the third stage while we are doing CBT for these people. Interestingly, and this again comes as a surprise for many people, there are medicines available as well. I mean, there are not as many or as effective as they are for medically assisted treatment for substance use disorders, but medicines have been tried. There have been trials where these have been found to be effective, at least to some extent. And especially they are of use when there is a comorbid condition, then their utility increases even more significantly. Finally, last 1 minute of my presentation, just to touch on the issue of prevention. Now, prevention of behavioral addictions is very different from prevention of SUD. As I mentioned earlier, for substances, the message can be say no to drugs, but for behavioral addictions, our message cannot be that say no to behavior, say no to eating, say no to exercising, say no to internet, no. So our message has to be very clear, very precise. And we need not kind of give this message to people that you should not use internet or you should not use mobile phones. Our message has to be that you should learn how to use them in a healthy way. You need to learn how you can avoid ending up having problems. What happens is that people get access to these devices without nobody telling them that what they're supposed to do with it or what they're not supposed to do with it. So the prevention should focus on the right kind of use, when to stop, for what purpose to use it, what is age appropriateness, how not to ignore other important parts of your daily routine and things like that. We need to approach many of these behavioral addictions as lifestyle issues. And what that means is that while SUD may be a problem for some of us, because a large proportion of us might not even experiment with substances, but some of these behavioral addictions, the behavior is of potential use for most of us. So it is something that we need to target all of us, target all children, all adolescents as they are growing up, because they will be engaging in most of these behaviors, at least to some extent. So we cannot just expect ourselves to target only the high risk population or people who are at risk of developing addiction. We need to target each one of us so that we can ensure that the problem doesn't come as people are growing up. So I'll conclude with that. I must mention that these are not entirely new concepts, but they are gaining much more importance these days. They are significant problem. They can cause multiple kind of issues. They share many features with substance use disorders and can be present simultaneously along with other SUDs. And we need to focus on these disorders when we are catering to our clients. And we might start getting clients who have only behavioral addictions as well, because the best place to manage these conditions is still those addiction professionals who have some understanding of the concept of addictions. So I'll stop there. I'll thank you all for your time, and I'll be more than happy to take questions if there are any.
Thank you, Dr. Yatin. It was very informative, very interesting, new concepts and old concepts put together. Beautiful. To begin with, I have one or two small questions. One is, was there any studies or research have been done about the link between behavioral addiction and substance use disorder? Because, for example, like gambling, as I see now, it is very closely also linked to the substance use disorder also. So was there any sort of a studies done about that link between both?
Yeah. So, Dr. Thomas, there are studies that have shown that people who have behavioral addictions, the risk of SUD may be higher in them. Similarly, people who have SUD may use gambling as a means to secure money, and some of them may eventually end up developing gambling disorder as well. So as compared to general population, these two conditions tend to be together more often than what we expect otherwise. So there is research that supports that. Yes, they do occur together simultaneously in some individuals.
Yeah, because I think even in Karnataka, they have stopped banned the single digit lottery.
Yeah.
The reason what they have given is that it is very much linked to also alcoholism. Like they drink and they go for that, and then maybe for not to support each other, each behavior maybe. Another one more just question I want to ask you is, you mentioned that ICDS and DSM-5 have recognized gaming and gambling are two behavioral addictions, which is as a disorder like. But of late now, because this internet and all these things are new, the smartphones and things like that, was it just a matter of time for them to recognize this way? I mean, these areas, or it is not coming in the diagnostic things like.
So, Dr. Thomas, what happens is that those people who work on deciding which ones to include, they rely on what other researchers have done. So if there is not enough research of the quality that they are looking for, they try to refrain from including these disorders. We must remember that while there are people who are bothered about others' health, there are other stakeholders which are bothered about the profits that they make by making people engaging in these behaviors. So it's not a very simple equation that, okay, if there is a problematic behavior, we will include it in ICD. The process requires certain prerequisites. So as of now, ICD thinks, or WHO believes, that only 2 of these are adequately researched to be included. But there is ample amount of research, say, on shopping and purchasing or buying addiction. Similarly, for sexual addiction, there is a lot of research that exists. The same is true for internet addiction as well. And I personally think that in years to come, they will be there in the diagnostic system.
Yeah.
Yeah.
Because the screen time, it interferes with all lot of priorities like, yeah. Okay, so over to others, there are a few hands up also. Shalini, please coordinate, or Ramya?
Sure, sir. Ramya, would you like to take this forward?
Yeah.
We have Abhijit.
Yes,
The question.
sir, in recent years, I have seen many young people are getting admitted in treatment centers for these type of problems, means excessive gaming, excessive, when they are, most of the times they are getting out with friends, etc. So when these people ask me why I am getting admitted here, I didn't take any kind of drugs. Then I used to tell them that if any behavior, any kind of behavior, may it be substance abuse, or other behaviors like that, gaming, gambling, etc., is making you unmanageable, then it is an addiction. Means, suppose in my house, we have 4 people. Everyone is using internet, everyone is using mobile phone, but one of them is getting unmanageable with it. So is it proper to use the word unmanageable? If any behavior is making you unmanageable, then it is your addiction.
Yeah. So if the word unmanageable means loss of control, then yes, you are absolutely
compulsion.
correct. Because that's one of the key features of any addiction, that you lose control in terms of the onset, the extent of use, when to stop, when not to use. But in addition to that, there are a few other features, like you start neglecting other important parts of your daily life. And finally, despite of knowing that you are having problems because of the behavior, you are not able to stop.
Yes.
So if a person has 3 of these core features, then we can say with reasonable certainty that yes, there is a problem.
Yes.
Yeah, so you're
Yes, sir.
correct in that sense.
So I wanted to ask you about pornography.
Mhm.
That seems to be very rampant among, I mean, the whole range, not just young people, but even
Mhm.
middle men, women. So is that, or
Yeah.
does that also come under the behavioral addictions?
So as I mentioned earlier, I removed that slide from my presentation. One thing that we need to demarcate behavioral addictions is normality. That is, what is normal and what is pathological. The second thing that we need to demarcate from them is that some of these behavioral addictions are actually known as other disorders. For example, I talked about eating addiction, but eating addiction as of now is known in diagnostic systems as binge eating disorder, which is not an addiction, but a binging, a different kind of conceptualization. So watching pornography excessively or engaging in sexual behavior excessively is still recognized as a problem, and it is diagnosable as compulsive sexual behavior, but it is not labeled as a behavioral addiction in ICD. It is known, or it is categorized as a different mental health problem. So it is there, but not as behavioral addiction, although some people think that is closer to addiction than the current conceptualization. So that controversy still remains, but it can be diagnosed and people can be helped using a different approach.
Right. Thank you so much.
Doctor, what I would like to ask is that behavioral addiction can lead into the suicide tendency?
See, people who have behavioral addictions, they can experience adverse consequences, and those adverse consequences can eventually end up in a person attempting suicide. The behavioral addiction per se doesn't cause suicide, but yes, the complications or consequences of behavioral addiction can eventually make a person attempt on their lives. So the rates of suicides are higher in this population as compared to people who don't have behavioral addictions.
I have one more question along with this. Like we have seen many of them addicted to maybe gaming or other pornography, and many addictions are there. Maybe addicted to the smoking, drinks, and other behavioral disorders are there. And all of them does not end with the suicide, but there are ratios says that most of them are those who have the behavioral disorder. They have ended with the suicide. So how do you see these things?
No, most of them don't end in suicide. Most of them they don't. Most do not. Only a small fraction ends into suicidal behavior.
Okay, thank you, doctor.
Yeah.
Hello. Hello. I have an interesting point. I'm quite interested to hear your opinion on. You work a lot with UNODC and other different organizations. Are they trying to promote a form of curriculum to integrate within schools to help children, all people within a changing world, of how to handle themselves? It's indirect learning, because what I found with my daughter is very different to my education. They have society. They learn about society and all this, and about inclusiveness, about all of the different issues, right? And about how to be a global citizen. But what they don't teach them is it's very little on this kind of subject, which is behavioral sciences, which now we've got. And I know a lot of this new world is online, right? And now since we've had COVID, we've got a problem, which is now it's work, food, exercise, entertainment, everything is in the home. You literally don't have to move from home. You can earn your money as an employer or employee inside your home, monetize yourself, and then you kind of lose and also have a social life, or a perceived social life, plus your exercise, YouTubing and things like that, and believing yourself to be in this kind of it's what we call a virtual world. Is UNODC creating a new curriculum, or is this conversation happening? Sorry, there's a bit monologue there, but
Yeah, no, I agree with your observations and the changing needs of the children growing up these days, but UNODC is unlikely to be the agency who will take lead on this because their mandate is on drugs and they don't talk about addictions, they talk about drugs. They talk about drugs which can lead to addiction as well. So it's unlikely to be UNODC, but yes, WHO is working and I happen to be part of that group as well. So right now they are creating a tool to kind of screen and diagnose, for example, gaming disorder. And the plan is that once the tool is there, they are likely to come up with some interventions as well. But it's going to take time. It's not.
I'm talking less about that. That's talking about looking at the crisis of the individual. I'm talking about before crisis, helping people from age 1, 2, 3, 4, and you grow, and it's indirect learnings, right? It's a bit like how they teach arithmetic and numeracy and literature. They don't actually teach them directly now. It's all indirect learning. And then they learn, oh, suddenly you can write. So how do you train people to be these behavioral so you kind of avoid the problem, right?
I get your question, but I am not aware of any such initiative as of now. I'm not aware of any of those. Yeah.
Okay.
Thank you, Jai. Rahat?
Rahat, please unmute yourself. Rahat.
Unmute, Rahat.
Oh, sorry, I forgot. Hi. So my view is that as far as substance use disorder is concerned, everybody is like having a vision about it, and they are ready to share their They are ready to share their experiences for that matter because society knows about it and people are ready to talk about it. But building an insight about this behavioral aspects, behavioral disorders or behavioral addictions, it will be definitely hard part of it. I mean, to build an insight among the people who are in it, because most of them will be in denial.
Yeah.
Because,
So
it's a personal experience. I have been, I mean, with someone who are having such issues, but due to denial, it was me who moved out, but the person who was in denial couldn't do anything with himself.
I can say that if you would have attended a seminar on SUD 20 years back, you would have made the same comment on SUD as well. There is a denial. I mean, human beings are strange. We are all very strange. We let the problem reach a level where it becomes unmanageable, and then we start to talk about it. So I believe that's a cycle that we are used to follow. But as time goes on, as we realize that, yes, this is something of priority, we will start talking more about it.
Yeah, definitely. People are ready to talk about screen dependency and other things now. That's true. But still, it's like society.
So the main concern there is that at times what happens is that we tend to compartmentalize ourselves. So there are a lot of addiction professionals also who claim that we are trained in treating people with SUD. There is no substance involved here. So it's not my domain. It has to be someone else who has to take care of this. So people, for example, the government agencies who have a mandate to treat substance use related problems, they will say that there is no substance, so it's not for us. Let the education department take care of it because they are bothered about children. So there are few takers for these as of now, even at the highest level. But at least at our level, we should be more sensitized and we should make that effort that we need to include it as part of our professional duties when we interact with our clients. So that may be the change that we can bring from our end. That's the least that we can do, I think.
Dr. Kusum, before Kusum, just one thing I just want to tell you. There is a small link shared in the chat box that is for claiming your certificate. So you can just click and enter your name and submit it, okay?
Done.
Over to Dr. Kusum.
Good evening, Doctor. Thank you so much for that insightful presentation. I just had two observations. One is I had a client which this didn't feature in your presentation, so I'm a little confused. So I wanted to clarify regarding that. This client was addicted to online debt. She was, taking debts online. I'm not sure if you are aware of this scam.
Taking what? Taking
Money,
money,
lending,
debt. Okay.
DEBT, debt.
Debt.
And you just explained the diagnostic three points on what is addiction, which suited all these three with her. But that point of time, it was so new and no one understood, or this didn't feature. But did you come across something like this? And how do we go about it? And like what you said, later on, when a psychological assessment was done, she was diagnosed with the personality, BPD, personality disorder. So most of the time, people like us who are counselors, not psychologists, this is where we stumble. We stumble upon things, and then it only with experience. It's a teamwork. I'm sure you agree with that. So that kind of teamwork doesn't happen everywhere is my concern. These are the two things: the teamwork of a psychologist, psychiatrist, and a counselor. There's always you have a smile. I'm sure you know what I mean. Thank you so much.
So, Dr. Kusum, I mean, we all know the answer to the second question. There is a great disparity when it comes to the demand and the kind of expertise that is available. There are, of course, sectors where people who can afford, they can access comprehensive models of care, but a person who cannot afford, there are very few opportunities in the public health sector, so to say. Coming to your first question, I mean, it's very difficult for me to give you a conclusive answer, but I'll say this much, that simply because one is doing something excessively doesn't make it an addiction. So that is one thing that we need to remember. For example, there are people who tend to practice a lot as players because they want to be good sports person. Now that is not considered an addiction, because we call that, okay, this person is practicing hard to become a good sportsman. There are students who tend to study a lot because they want to score good marks. We don't call it as addiction simply because they are studying a lot. So a person taking debts online, it automatically doesn't become an addiction because you are doing it too often or too frequently. We need to see what is the intent behind that. Is it a behavior that is of interest or pleasure? Did this person even try to control it? Are there reasons for this person to do this? So those kind of questions we need to ask. But simply engaging in something excessively, we should not equate it with addiction. And there are so many things that people do in order to kind of achieve perfection in doing that. Or they may have different reasons of doing that. So we need to go at the core of it. So all those details will be needed before I can suggest that whether this is an addiction or not. Personally, I have never diagnosed it. I have diagnosed patients with gambling addiction, and they have taken debt a lot of times, but not because they came to me telling that I have a habit of taking debts. They came that, okay, I engage in gambling. To sustain my gambling, I have to take debts. So that I have seen very often. But I personally have never seen a person or diagnosed a person that has come to me saying that I like taking debts online. I have never seen such a case.
She doesn't have any memory of doing it, but after doing it, like she's just simply helpless, and it appeared to be addictive because it one after the other she went on, and then we had to physically bring her back from another city where she lived, and intervention was done.
See, again, I am not in a position to give a concluding comment, but not having a memory will make me think of other possibilities, because addictive behaviors, people, when they engage, they tend to remember because it's a conscious behavior we are engaging in. So I would be tempted to think of other possibilities.
But it can go in line with the gambling also, no? Like, I mean, more or less same diagnostic criteria.
Dr. Thomas, she's saying that the person won't recollect whether she has done it or not. which doesn't happen with gamblers. They do remember what they've done. So there is something else I think that we need to consider.
Okay, thank you. Ronnie, you have something?
Ronnie?
Yes, Dr. Yatun, do you think behavior addiction can act as a pain relief or a pain numbing effect from anxiety or daily stresses, or use it as a negative stress management? What are your thoughts on that?
See, typically substance use has been attributed to have that property that yes, for some people it can take away your pain. When it comes to behavioral addictions, they don't, I mean, in the sense of the physical pain, they don't work in that way. But yes, they can be very effective distractions for some people. So because if you are stressed or if you're worried because of some reasons in your life, engaging in a particular behavior may help you get distracted from it. So that psychological pain, yes, they can take care of, but may not be the physical pain as we see with certain substances which they can take care of. But yes, for psychological pain, they can be a good distraction for some people.
Thank you.
Dr. Dhillon.
Good evening, sir. Thank you for such a wonderful presentation. Sir, I have one query pertaining to the molecules mentioned for treating these behavior addictions. Sir, among your clinical practice and experience, among all these, which has been a promising molecule for treating gambling or gaming disorder?
See, I will deliberately not answer that question because the answer is very complex. It's not about naming two of these medicines. I will have to explain so many other things before I can even speak of a name, because there are so many caveats, there are so many limitations in the evidence, and there are so many contexts that we need to keep in mind. So I cannot tell you that, okay, this is the medicine and start using this for all your patients. So I'm sorry, but I'll refrain from recommending one or other molecule for this purpose. I'm really sorry, but I'm not in a position to give you a very simple answer on that.
Doctor, there was one or two questions in the chat box. One is about the genetic link with the behavioral addiction. Is there any sort of a genes, do they play any role?
Yeah, there is evidence, especially from gambling disorder, that there are some genetic alleles. They tend to be more common in some of the addictions, but again, it's not conclusive. There is no single gene that has been linked to it. But yes, it has been proposed that genetics increase the risk of behavioral addictions, gambling, and to some extent gaming as well.
Girish is asking, can we call it as a personality disorder also, behavioral addictions?
I would say no, because that concept of personality disorder is very different from the addictions. Even what people used to say that there are people with addictive personality, that concept is not very well supported these days. So this is very different from personality disorder, in my opinion.
Any other questions? Ramya,
Yes, sir. Yes, sir. Dr. Mohammed has a question. He asked, which mental disorder is more common in drug addicts?
Okay, so people who have substance use disorders, two of the commonest disorders are anxiety disorders and depressive disorders. Some substances can also induce psychosis as well. So these three would be the most important ones. Also, personality disorders, especially antisocial personality, borderline personality in females, they are also common.
Thank you, sir. We have one more last question in the chat box, and Zoeb asked, what are the main causes of behavioral addiction?
Okay, so again, there is no single straightforward answer there. There are multiple factors, biological, psychological, environmental. For example, the neurobiological pathways that I talked about. In terms of psychology, there can be things like risk-taking, harm avoidance, novelty seeking, traits like that. And then from the environmental perspective, how soon were you exposed to that behavior? Were there any alternatives that you had an opportunity to engage in? What is your peer group engaging in? What kind of peer pressure? Do you fear missing out on something if you don't follow what your friends are doing? So there are multiple factors that are at play. So it's again is a complex interaction. It's not very simple like you remove this thing and everything will fall in place.
Thank you, sir. I can
you.
see Ramya's hand. Ramya.
Last question from Ramya, and then we close.
Ramya?
A very quick question.
Yes, sir. Yes.
Any specific screening or assessment tools you'd recommend for counselors? Because there are, while although common sense prevails that we have to check who diagnosed this, is this self-diagnosis? Most of the time it's self-diagnosis. And most of the time there are a lot of underlying assumptions and all of that. Even though we correct all that, as a counselor, we are not supposed to diagnose any disorders or not give any diagnosis per se. But for our reference, to recommend them to a psychiatrist, what screening assessment tools can we use as counselors?
Okay, so for gambling, there is a screening tool which even counselors can use. It's called South Oak Gambling Screening Questionnaire.
Yeah.
It's a most widely used tool. For gaming, I'll suggest two. The most commonly used one is called Internet Gaming Disorder.
There is a, correct, there's an internet addiction test.
No, not
that's for diagnosis.
No, I'm saying Internet Gaming Disorder.
Internet gaming.
9-item short form questionnaire. IGD-9SF, that's the short form. IGD-9SF.
Okay.
And there is one that we have developed for India as well. I mean, I must mention there is a conflict of interest. It's been developed by our team. It's called Gaming Disorder and Hazardous Gaming Scale.
Okay, gaming disorder and hazardous gaming scale.
Yeah, so these are the tools that can be used. They are freely available. All these can be accessed or downloaded and used freely.
Okay.
They don't need any permission.
Other than these, for all the other behavioral, sorry, just one more thing. Yeah. For the other behavioral addictions, whether they are addictions or not, and you said also one must be mindful of, are these really behavioral addictions or other disorders, like to recognize if there are some other disorders, yes. So in that case, is there anything that one must keep in mind other than the simple checklist of, you know, the reason, the motivation, the frequency, the difficulty in managing or stopping the behavior? Other than this, is there anything one can keep in mind?
No, for others as well, there are multiple tools. For shopping, shopping and buying, there are tools that exist. For excessive sexual activity, there are tools. I am not deliberately going in the direction because then I have to put those disclaimers that they are not as valid because the concept is not valid as of now.
Clinically
verified. Caveat is there. But if you just want to see whether somebody is at risk, there are tools that exist for all these disorders. There are multiple that exist. So you can use them.
Okay, understood. Thank you. Thank you.
I really feel that we need more of Yatin sir's session to learn. There's so much to learn in this topic that we'll request Yatin sir to, you know, come again and guide us on the same. Before forwarding this and before giving it to Ronnie, may I please request everyone to be in video for a quick photograph?
Yes, Shalini, Tiara.
I request. Yes, Ronnie.
Yeah, Tiara was supposed to take.
He's our photographer. Yes. After that, there's a short vote of thanks by Ronnie. Okay.
Yes,
After that, we will go.
I request each and everyone to be in video, please. Thank you so much.
And smile.
Everyone smile for at least 10 seconds so that we can take a photograph, a good photograph.
Have three pages, Ronnie. So keep smiling.
Okay. Ronnie or I take a picture? Maybe.
Yes, Tiara. Yes, please go ahead.
Okay. There is a 5-page in my notebook. So please hang on, all right? Okay, first page.
Second page,
1, 2, 3, cheese. Okay.
Second page. Done.
Second page. Please.
Guys, we have still a lot of people who are not on video.
Okay. 1, 2, 3, cheese. Okay. Page 3. Okay. Hang on. 1, 2, 3, cheese.
Okay, Tiara, good job, good job.
No, it's still 2.
They're still smiling even if they are not in video.
3. Okay, last page, Dr. Thomas. 1, 2, 3.
Okay, thank you, Tiara.
Thank you very much.
Thank you
Over
so
to
much.
Ronnie. Ronnie for a word of
Vote of thanks. Thank you.
Thanks a lot to everyone.
Thanks a lot. Once again, I'm reminding you that there is a link in the chat box to apply for your certificate.
Just click.
Finally, okay, for the vote of thanks, grateful evening to everyone. It's my privilege to propose a vote of thanks on this occasion. I, on behalf of Echolink Institute and UTC Alumni Association, I'd like to thank you all on joining us on this webinar. I extend a very hearty vote of thanks to Dr. Yathan for gracing your important work and sharing your knowledge with all of us. We have learned a great deal. A big thanks to the members of ISEP India and Colombo Plan for continuous support towards Echolink Institute and its alumni members. We have had an inspiring, powerful, diverse group here, spanning from around the world who have joined for this webinar. It was only possible because of our UTC Alumni Association. And I very much appreciate you all. Once again, I thank you all for being here.
Thank you, Ronnie. Thanks a lot.
Thank you.
Thank you, Dr. Yathan.
Thank you, Yathan sir.
Thank you so much, sir.
Thank
you,
Yathan.
Thank
you. So much.
Thank you, Yathan sir.
Thank you all. Thank you,
Thanks a
Dr.
lot,
Yathan.
sir.
Thank you.
Thank you, Dr. Thomas.